Eat stress-free this spring with Factor's ready-to-eat meals. My family and I have tried them and they are delicious. Every fresh, never frozen meal is chef-crafted, dietitian approved, and ready to eat in just 2 minutes. Choose from a weekly menu of 35 options, including popular options like Protein Plus or Vegan and Veggie. Also discover more than 60 add-ons every week like breakfast, on-the-go lunch, snacks, and beverages to help you stay fueled and feel good all day long. What are you waiting for? Get started today and fuel up for your spring. These are no fuss, no mess meals, no prepping, no cooking, no cleaning up. Simply heat up and savor the good stuff. They're tailored to your schedule. You can customize your meals with the flexibility to get as much or as little as you need. Pause or reschedule deliveries to suit your lifestyle. Head to factormeals.com/drnicole50 and use code drnicole50 to get 50% off your first box plus 20% off your next box. That's code drnicole50 at factormeals.com/drnicole50 to get 50% off your first box plus 20% off your next box while your subscription is active. It is Black Maternal Health Week, and I'm sharing some facts about Black maternal health. Welcome to the All About Pregnancy and Birth podcast. If you're having a baby in the hospital, you are giving birth in a system that too often takes away power from women over what happens in their own bodies. I'm Dr. Nicole Calloway Rankins, a practicing board-certified OBGYN who's had the privilege of helping well over 1,000 babies into this world. I've been a doctor for over 20 years, and I'm here to help you take back your power, advocate for yourself, and have the beautiful pregnancy and birth that you deserve. This podcast is for educational purposes only, and it's not a substitute for medical advice. Check out the full disclaimer at drnicolerankins.com/disclaimer. Now let's get to it. Hello there. Welcome to another episode of the podcast. Whether this is your first time listening or you have been here before, I am so glad you're spending some time with me today. It is the 7th annual Black Maternal Health Week for 2024. It is from April 11th through the 17th. Black Maternal Health Week was founded by Black Mamas Matter Alliance. The Black Mamas Matter Alliance is a national network of Black women-led organizations and multidisciplinary professionals who work to ensure that all Black mamas have the rights, respect, and resources to thrive before, during, and after pregnancy. Black Mamas Matter Alliance honors the work and historical contributions of Black women's leadership within their communities and values the need to amplify this work on a national scale. The Alliance is composed of existing organizations and individuals whose work is deeply rooted in reproductive justice, birth justice, and human rights frameworks. Now, Black Maternal Health Week is a week of awareness, activism, and community building aimed at amplifying the voices of Black mamas, bringing visibility to Black-led maternal health initiatives, and centering the values and traditions of the reproductive and birth justice movements. Now, the theme for Black Maternal Health Week 2024 is Our Bodies Still Belong to Us, Reproductive Justice Now. Widespread restrictions on abortion care access, along with rising cases of criminalization due to pregnancy loss, continue to widen the gaps of adverse maternal and birth outcomes in the U.S. And many of the states that have the worst maternal and child health outcomes also have the least supportive social and family support programs, particularly for Black women and birthing people. This year's call is that the time is now to demand comprehensive insurance for maternal, sexual, and reproductive health, improve access to care, guide healthcare entities on equitable quality care, and fund research prioritizing all Black women, Black mamas, and Black birthing people. Yes to all of that. And just to give credit, all of that information was taken from the Black Mamas Matter Alliance. And one of the things that I hear a lot, or that seems to be just getting increasingly prevalent, is that anytime we talk about something related to a specific group, particularly with Black people, there's this, why are you being exclusionary? Why are you not focusing on everyone kind of thing? And there are a couple things that I want to say about that. One is when we focus on our most vulnerable communities, we actually uplift everyone. Things that improve the most vulnerable among us, the people who are affected most negatively by things, that's going to uplift everyone. And then the second thing, talking about the needs of a specific population doesn't mean that you're leaving out someone else. There is room to do both. Kind of a crude example of this is if you have one child who's sick, it doesn't mean that you are ignoring your other child. Even if you have two children who are sick, when you give attention to one, it doesn't mean like you don't recognize that there are issues or concerns that are going on with the other. So there is room to talk about the issues and the things that affect the Black community and incorporate that into the larger issues that affect our maternal health care system in general, knowing that when we focus on these issues, it helps us all. Now, one of the things that I do to help during Black Maternal Health Week is to collect donations to give away spots to Black mamas in my online childbirth education class, the birth preparation course. The birth preparation course is, of course, my online childbirth education class that gets you calm, confident, and empowered to have a hospital birth. In particular, please give anything that you can to give away spots. I, of course, will be giving away several spots, but I would love to collect enough from my community that my community gives away at least 10 spots. So that would be on the order of about $2,500. So contribute anything you can at drnicolerankins.com/help. I would greatly, greatly appreciate it. About 95% of pregnant women are not getting their recommended daily intake of key omega-3s. Enter Ritual. Their prenatal contains 350 milligrams of eco-friendly vegan omega-3 DHA in every serving. One of the things I like about Ritual prenatals is that they are rigorously tested and validated by a third party for allergens, microbes, and heavy metals. Ritual works with world-class certification bodies to validate their products. Their multivitamins are vegan, non-GMO project verified, gluten and major allergen free, and certified B Corp. That means they're holding themselves accountable to not just their company's financial health, but also the health of people and our planet. Why settle for a multivitamin you're not 100% sure about? Ritual was literally built on trust, so you know it is the real deal. Get 25% off your first month for a limited time at ritual.com/Dr. Nicole. Start Ritual or add Essential for Women Prenatal to your subscription today. That's ritual.com/Dr. Nicole for 25% off. Now let's get into some of those facts about maternal health. Let's start off with maternal mortality. We talk a lot about this. So in 2021, the maternal mortality rate for non-Hispanic Black women was 69.9 deaths per 100,000 live births. That's 2.6 times the rate for non-Hispanic white women. Also in the U.S., Black women are 3 times more likely to die from a pregnancy-related cause than white women. And the CDC notes that more than 80% of pregnancy-related deaths are preventable. Now, I will say that this data has been called into question recently. There was a study that found that the maternal mortality rate is actually overestimated, that it's actually a lot lower than what's reported, and that's based on some reporting issues with the surveillance system. However, those disparities still exist. So Black women still have a rate that's 2 to 3 times higher. It's just that the overall rate for everyone is actually lower than we thought, which is a good thing. Now, when we look at maternal mental health, one study found that Black women were 2 times more likely to report suicidal ideation in the immediate postpartum period in comparison to their white counterparts. And in the United States, 29 to 44% of Black women experience postpartum depressive symptoms, yet few are properly identified and are connected to the mental health care services we need. We know that mental health services are a problem in this country in general, and then particularly more of a problem for our marginalized communities and communities at risk. So for breastfeeding, about 77% of Black infants are breastfed, compared to more than 85% of white infants and 81% of Latina moms. When we look at reproductive rights, among the 10 states with the largest non-Hispanic Black population in 2020, so that's Alabama, Arkansas, Delaware, Georgia, Louisiana, Maryland, Mississippi, North Carolina, South Carolina, and my state of Virginia. Many of those states have implemented very severe restrictions on abortion access. So particularly those southern states, Georgia, Louisiana, Mississippi, Alabama. Those are also the states that have some of the highest rates of disparities in maternal and infant health outcomes. Those things are not a coincidence. And we know that the impact of restrictive abortion laws and denied abortion care will disproportionately affect Black mamas. They don't have the same access to quality family planning services and also don't have the same economic access to pursue other options, for example, going to another state for needed reproductive care. Now, when we look at quality of care, research indicates that 22% of Black women receive lower quality of care, and whereas 20% of women overall reported experiencing mistreatment during maternity care, according to a CDC report, that number was higher for Black women at 30%. And as we wrap up, when we look at reproductive cancers, Black women have a higher incidence rate of cervical cancer compared to women of other racial and ethnic groups. They're more likely to die from cervical cancer. And then uterine cancer is one of the few cancers with increasing mortality, where death rates have actually increased, and Black women are far more likely to die from uterine cancer compared to other racial and ethnic groups. And then finally, preterm birth. This has been a long-standing problem. In 2022, the rate of preterm birth among Black women was 14.6%, which is about 50% higher than the rate of preterm birth among white or Hispanic women. Among white women, it's about 9.4%, and Hispanic women, 10.1%. All right, so there you have it for those fast facts about Black maternal health. I would so appreciate it if you help come together as a community to donate spots to give away to Black mamas in my online childbirth education class, the birth preparation course. Head to drnicolerankins.com/help. Contribute whatever you can. I'd love to collect $2,500. I would be so appreciative of anything that you can contribute to that. So that's it for this episode. Do come on back next week and remember that you deserve a beautiful pregnancy and birth.